Joined now by leading clinical oncologist Professor Pat Price, who established the first academic department of radiation oncology at the Christie Hospital in Manchester. Morning to you. Can you tell me, it is a good thing that there is early diagnosis? There are concerns that there's not enough early diagnosis. However, more cancers or people with cancer is being diagnosed.
Yes, and that's sad. The figure is over 400,000 now. The problem is we don't have the capacity to treat everybody. As the report shows, although over the last 50 years things have improved, they've really stalled. And as I've been on this programme many times, we are failing to get all the people treated on time.
It is sad that more people are being diagnosed, but isn't it a good thing that more cancers being spotted?
All of that, we must have early diagnosis and we must have fast diagnosis. But the problem in front of us now is we don't have the capacity to treat all these people on time. Our cancer survivals are poorer than they should be.
What's on time?
62 days is where we should be, recognised internationally. From putting you in for a suspected cancer to treatment should be 62 days, and our figures are really poor. That's the National Cancer Plan, is really prioritising trying to get those figures up to the 85%.
Just looking through some of those figures, and you alluded to them there, waiting times are worsening, as you say. 107,000 patients waited over that 62-day period for treatment. That was in 2025. More than 100,000 people. It's
appalling. It's appalling. And why it's important, there is good data showing that if we delay, more people die, you have an increased risk of death. So our figures show thousands of people are dying unnecessarily.
Is there, what factors have to play in that waiting time? Does geography have a part to play? Are there places and areas that are doing better than others?
Yes, geography certainly, but mainly there is some hospitals have really been able to manage this and others haven't. The BBC on their website have a tracker of which hospitals are doing well. It's a real spread, but the poor ones are very poor and some people are dying unnecessarily. We don't have the capacity to treat all these new patients, and this figure is going up 2% each year. It's baked in now. Is
the 62 figure, the 62-day figure, is it realistic, considering what is available in terms of facilities? So you say that some hospitals are so poor, so lacking in funding that they can't, you know, that they're much longer than this 62-day figure. I'm not saying is it a good figure, but is it a realistic figure with the circumstances we're in?
I think it should be non-negotiable. If the UK cannot get patients in front of people to treat them in 62 days, we are failing. This is an international figure.
So then we are failing at this moment in time. So what needs to be done and what can be done?
There is so much that needs to be done. The Cancer Plan had a great vision, but it had no detailed planning or no implementation. There is no resource attached to it. So we say, no money, no people, you will get the same outcome. But if you have a plan without a resource, it forever remains an aspiration, and that's terribly sad.
So where's
but
the
there
resource
is
coming from?
People. There's a lot of things we can do. First of all, and also academically, we've said this so many times now, you've got to get it top priority. This has got to be the #1 thing we've got to be in people's head to do. And we've got to take from other things. How did Denmark do it? They made the 62-day wait compulsory legally. They also took the cancer plan out of the political cycle. We will need 10 to 20 years to get this back on track. And this can't be done by changing plans. And we need to be absolutely radical. The resource is the people we've got. Throwing more money at it won't necessarily get it right, but you do need some money.
We should say, the Department of Health statement is saying we have delivered a record number of diagnosis tests in the last 12 months, backed by an extra £26 billion for the NHS, and they will point to the figures.
The cancer plan, as they said, didn't come out with any particular new extra resource. But it's not just the money. What it's lacking is we need a plan and leadership, accountability. We need that Kate Bingham moment that says, do it, get everything out of the way. As frontline staff, we feel really excluded from this. everybody on the front line should be getting their ideas in, improving things every day in every way. This is such a big problem. I can't emphasise it enough. But there are some great frontline staff. We could do this, but we need a radical change of direction here.
Your reference to Kate Bingham, of course, who chaired the vaccine task force during COVID. Professor Pat, thank you so much for joining us this morning. Professor Pat Price, thank you.
Over.